Hi, I'm Marvin Plackett, and today is Wednesday, June 24th. Greetings to all residents, to all staff, and to all guests. I'm pleased to report that once again, we have no new confirmed cases of COVID-19. And so that means that we still remain stubbornly, but it's not a bad number in relative terms, but at 5. We have 5 active cases of COVID-19 at this time. 2 are residents and 3 are staff. And those 2 residents, of course, have been for some days now in our dedicated COVID-19 unit at Episcopal Church Home. Testing at the gardens for the entire facility of the gardens, all 6 floors, all 6 houses, all residents and all staff, that will be wrapping up today. And so we expect to have results ideally by the end of Friday, and we will have a solid indication of how we are standing at this moment at the gardens. So certainly we will give you an update just as soon as we know, and probably all the tests won't come in all at once, but I might even have some updates for you already tomorrow, and then more updates on Friday, and then certainly more updates on Monday. Reminder that this is the last day of National Nursing Assistant Week. So if you have not yet reached out to one of our many nursing assistants that we have at Episcopal Homes, do that. They will appreciate it. Express your gratitude for the work that they do. And now I'm speaking to all nursing assistants. Thank you. Thank you. Thank you. You do really you're the backbone of the vital, important work that we are doing here. Happy National Nursing Assistant Week. I'm sure that you are watching the news as I do, and you would have seen that yesterday Dr. Anthony Fauci, that he testified in front of a congressional committee yesterday, and he expressed some serious concerns about where we are as a nation in terms of our COVID-19 status. Because in a number of states, as you know, the numbers are rising, and in some states the numbers are peaking right now. And while in Minnesota here we have stabilized, and in fact perhaps decreasing some in our numbers, so we're in a relatively good situation here in Minnesota. Nevertheless, what's happening throughout the country, it indirectly or directly could affect us here. So it's just a reminder, and as Dr. Fauci emphasized yesterday, those key issues of wearing a face mask at all times, of 6 feet of social distancing, those are really vital. If you have any symptoms, staying in your room, staying in your apartment, staying home, and calling your healthcare provider and letting us know. And get tested, of course, because tests are available. So those are vital features. And Dr. Fauci, he expressed deep concern and chagrin at where we are as a nation right now. But yet he ended with some hope. He said that he has some cautious optimism that by the end of the year or early next year, that we may have a vaccine, or he said we could have a vaccine, or we will have a vaccine, I'm not sure, but he said he's cautiously optimistic. So we will see. Certainly not all epidemiologists or experts are that optimistic that we will have a vaccine that soon, but we will see. Nevertheless, let's say that it is by the end of the year. That means we have several months ahead of us, a full 6, 7, or many more months, we just don't know, ahead of us. So these basics of social distancing, of wearing our face masks, washing our hands frequently, keeping isolated, self-isolation if we have any symptoms, and then getting tested, those are just really vital features so that we, here at Episcopal Homes, don't take steps backwards. So that's what we are really working. All of us have to work vigilantly on that. No, you're not in a twilight zone. I know something has changed. We goofed with the technology here in the camera situation, and so I'm redoing a portion of my message for today. Eileen Lardy, she lives at Cornelia House, and she sent a message that I want to read to you pertaining to how our new channels have influenced her her day and her week in terms of some of the benefits that she's getting. So this is from Eileen, and Eileen, thank you so much for doing this. I very much appreciate the new channels on our lineup. I thank everyone on the team that has worked so hard in getting them up and working, and by the way, for their patience with my comments and suggestions. Eileen, we're glad to be patient. We're appreciative of your suggestions, really. Here is how I have incorporated the offerings on channel 3.1 into my daily routine. 10:30 senior exercise, 7 days a week. Every day is different. Intensity varies, mostly sitting, some standing with or without a chair. Length varies from 15 to 30 minutes. I like the variety of personalities, but especially the upbeat attitude of Paul Eugen sessions. Okay, we'll trust you, Eileen. 10 p.m., 7 nights a week, a 15-minute relaxation / mediation, but I think that means meditation, practice. So much nicer than watching the news. I get that. Different each night, different personalities. Love the variety. There are at least 2 occasions during the day / evening to see Marvin's daily updates if I miss them at 10:30. I didn't know that. Good to know. During the afternoons, there is a good variety of pertinent documentaries, audiobooks, concerts, etc. Recently, I enjoyed watching Episcopal Home's own Agnes in Slumberland. Yeah, it's great. The documentary 13th. If you haven't seen 13th, watch the documentary. It's terrific. It's on Netflix and also, I guess, on our channel. Joni Mitchell's 1970 London concert. I'm looking forward to watching the Royal Danish Ballet this week and Dr. Seuss Raps. I heartily encourage everyone to check out the programming guide on channel 3.2. It's your TV guide, so to speak, as to what's showing on channel 3.1. There is a week's programming listed, so you can decide what you'd like to see. And then also Eileen, she sent me a follow-up email, and she said, I forgot to mention the 12 noon Tai Chi class. It's excellent. All right, thank you so much, Eileen. I appreciate that. So check these things out. And then I just want to remind everybody that if you have any ideas or questions, topics you want me to address at my daily update at 1:30, just send me an email to mplackett@episcopalhomes.org. I will be glad to do that. All right? Take care, everyone. I look forward to seeing you tomorrow at 1:30. Bye-bye.